Good. My name is Brianna, and I'll be taking care of you today. I'm going to do a complete neural assessment on you and check some of your cranial nerves here for you. So as I look at Rachel here, she has a good general appearance with her clothing and her hygiene. She has a normal affect and mood here, and she has a normal level of conscious forming. I'm going to first check her trigeminal nerve here for you, and that is nerve number 5. I'm going to use a Q-tip here, and I'm going to let you feel this is the soft end, and then this is the sharp end.
Okay.
So I'm going to check here on your face on a few spots, and you let me know if you feel the sharp or the soft end, okay?
Mm-hmm. Soft. Sharp. Sharp. Soft. Sharp. Soft.
All right, good. So her trigeminal nerve is intact. I checked her forehead, her cheeks, and her chin there. Next, I'm going to be checking her facial nerve number 7. I want you to close your eyes tight for me, and I'm going to try and open them, but don't let me open them for you. Good. Now open your eyes wide and lift up your eyebrows for me, and I can see that there are wrinkles in her head, so she's able to wrinkle up her forehead, so that's good. I also am going to have you smile for me and show me your teeth, and then clench your teeth really tight for me. Good. Now I'm going to have you puff up your cheeks for me, and I'm going to try and puff the air out, but don't let me do that, okay? Good. Kept it tight in there, so her facial nerve is intact. Next, I'm going to be going ahead and checking her cranial nerve 3, 4, and 6, which has to do with your eyes. So I want you to follow my finger here for me. Good. Good. She followed them well. There was no nystagmus of the eyes at all. Next, I'm going to check your corneal reflex here. So I'm going to have this Q-tip that I have here, and I'm going to go in from the side and touch your eyes and see if you blink. Good. She blinked there. Good, and she blinked. Let's see. Next, I'm going to go ahead and check in the pupils of your eyes. So right now they are symmetrical, and I'm going to watch the dilation of your eyes. Good. Good. They are both equal and reactive to light. And now I'm going to check the consensual reflex of your eyes. So I want to make sure that both of the pupils dilate together. Good. So the consensual reflex is intact. I'm going to go ahead and check accommodation, where I want you to look behind me at that picture back there, and then I will tell you to look at my finger and then look back at the picture. So you can start and look at the picture frame, and look at my finger, and back at the picture frame. Good. So the accommodation is good. So her pupils are equal, round, reactive to light, and accommodation. So that is good. Your nerves are intact there. I'm going to check next your optic nerve, which is nerve number 2 here for you. Normally we'd use a Snellen chart, but we do not have one of those here. So what I'm going to have you do is cover up one of your eyes, and I'm going to see when you can see my fingers coming into your periphery, okay? So ready? Tell me when you see my fingers.
Okay.
Good. Just keep looking at my nose here.
Okay. Okay.
All right. Next eye. Just keep looking at my nose and tell me when you see my fingers.
Okay. Okay.
Good.
Okay.
Good. All right, next I'm going to check the acoustic nerve, which is nerve number 8. I want you to plug one of your ears there so that you can't hear it out of the ear, and I'm going to whisper into the other ear and see if you can hear what I say, and just repeat it back for me.
Mm-hmm. Yep.
All right, so her acoustic nerve is intact there. Next, I'm going to be checking nerve number 9 and 10. And what I want you to do, well, first, normally, she's been speaking normally and swallowing normally throughout this assessment. So her gag reflex, we do not need to check unless she was an unconscious patient. So what I'm going to have you do is open your mouth and say "ah" for me. Good. So that shows that the rise and fall of her uvula bilaterally was equal there. Next, I'm going to check your nerve, cranial nerve number 12. I want you to stick out your tongue for me and push it side to side. Good. So her muscles are intact there. And finally, I'm going to do a complete neuro check on you. And what I would like you to do for me is follow my commands when we're going to move our fingers. Have your thumb to your pinky and go every finger all the way to your index finger and then back to your pinky for me. Good, and that was equal there, and she was able to follow those commands. Next, I'm going to move the camera so that they can see your shins. And I want you to glide each heel up and down your shin here. Follow that. Okay, next one. Good job. All right, next I'm going to have you stand up, and I would like you to walk just walk normally for me to the window and back. Or actually just to the window. Alright, so she has a good gait there that I can see. And then next I'm going to have you walk toe to heel, yep, heel to toe for me. And she has good balance there and is able to follow those commands. And then finally, I'm going to check your Romberg's test, and I want you to stand with your feet together and your arms at your side and with your eyes open. And she has good balance here for me that I can see. And then next I'm going to make sure that I watch in case she were to fall or wobble at all. And I want you to close your eyes. Alright, and she had a good Romberg's test. She passed that. She wasn't wobbly at all. So you're good to go, Rachel. You can sit down. And we are now finished with the neuro assessment, and I'm going to wash my hands. And thank you, Rachel.